Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about Pyoderma Gangrenosum. By definition, Pyoderma Gangrenosum is a chronic condition that is characterized by recurrent, painful, progressive ulcers that form on the extremities, especially the legs, of individuals that have autoimmune disorders or after physical trauma, but sometimes they can occur spontaneously without a patient having autoimmune disorders or without physical trauma. The majority of the time, these ulcers occur in patients that have been physically traumatized or they have autoimmune disorders. Autoimmune disorders, by the way, is when your body turns against itself and destroys its own tissues. Ideally, our immune system is supposed to attack only the foreign agents within our bodies, for example, germs. But in a setting of autoimmune disorders, the body confuses the normal tissues of the body and then it turns against them and destroys them in the process. And so we end up with a condition called an autoimmune condition, an autoimmune disease. Pyoderma gangrenosum is in itself an autoimmune disorder because the neutrophils, the white blood cells that are supposed to fight off bacteria within our body, infiltrate the cells of the skin and destroys them. The parts of the body that are commonly affected by Pyoderma gangrenosum include the lower extremities, especially the legs. And most often it is the skin that overlies the tibia, that superficial bone that you can easily feel in your leg. So that skin over the tibia is the commonly affected. But you can also find the lesions on the feet and the ankle region. You can also find the lesions on the chest, the abdomen, the neck, the arms, but sometimes in the genitals. The individuals that are commonly affected by Pyoderma gangrenosum include females between the age of 20 to 50 years, individuals that have systemic conditions, for example, ulcerative colitis, a condition that is characterized by inflammation, irritation of the colon and the rectum, Crohn's disease, which is a condition that causes inflammation, that is irritation of the small intestines and the upper part of the colon, rheumatoid arthritis, a condition that is characterized by inflammation of the joints as well as pain and stiffness and swelling of the joints, leukemia, which is a cancer of the white blood cells, as well as patients that have lymphomas, a cancer of the lymphatic system, the system that collects fluids from the cells of your body. The clinical presentation of Pyoderma gangrenosum is that the lesions usually start as small swelling, some bumps, blisters that form on the skin. Usually they are purplish in color, but they can be red, black, or brown in color. These small lesions sometimes contain pus and they continue to grow in size and they join. After some time, the skin over the blisters get eroded to form one huge ulcer. Sometimes the ulcers that are formed can be multiple in number, many in number, but sometimes the ulcer can just be a single large ulcer. After a very long time, the ulcer can heal, forming what we call a cribriform scar. The patients can also have other symptoms, for example, joint pains and fevers. So please, if you happen to see any of the signs that I've just laid out for you, please come to the hospital for proper investigations and diagnosis, especially for the underlying conditions, because 70% of the time, patients that present to the hospital with Pyoderma Gangrenosum lesions also tend to have some underlying systemic conditions. For example, ulcerative colitis, Crohn's disease, rheumatoid arthritis, leukemia, and lymphomas. And these conditions tend to increase the possibility of death in the patients. That is, the death rate increases by 30%. So please come to the hospital because you also might be battling some other conditions that you're unaware of, the conditions that I've just detailed. Also, if these conditions get discovered and treatment is initiated, the Pyoderma Gangrenosum lesions also tend to disappear faster. If there is any underlying condition and it is not discovered, the lesions are going to persist for life. So please come to the hospital such that we can also initiate treatment just in case there is any underlying systemic conditions. The other thing is that Pyoderma Gangrenosum is a very difficult condition to diagnose and treat. This is because we need several investigations to rule out a possibility of other conditions. And the lesions also take a very long time to heal. So that means the affected individuals have to be patient with their bodies, and also the doctors that are attending to the affected individuals have to be patient to carry out all the tests required and to also take the necessary steps that are required for the lesions to heal. The investigations that we carry out in Pyoderma Gangrenosum include some blood tests, for example, a complete blood count, a peripheral blood film, as well as rheumatoid factor. We can also do biopsy of the lesions. We can also do bone marrow aspiration and analysis. We can also do a proctoscopy and a colonoscopy. When it comes to the treatment of Pyoderma Gangrenosum, the following interventions have shown to work. Medications that reduce inflammation, for example, corticosteroids. This can be used as ointments or creams that can be directly applied on the lesions, or they can be taken orally, for example, prednisolone. Medications that reduce pain, because majority of the time there is a lot of pain emanating from the Pyoderma Gangrenosum lesions. Usually we use the non-steroidal anti-inflammatory drugs, for example, aspirin and ibuprofen. Antibiotics, for example, the topical antibiotics. Usually we use silver sulfadiazine, which we just apply on the lesions. We also use immunosuppressive agents, the immunosuppressants, for example, cyclosporin and mycophenolate. We also do some interventions to promote ulcer healing. For example, we do debridement. Just in case there is any dead tissues, we cut them away, but usually we do gentle debridement. We don't do the extensive, aggressive debridement because this can just worsen the Pyoderma Gangrenosum. And we also do daily wound dressing. We can also employ biological agents, for example, infliximab, which usually targets the proteins that take part in this inflammatory process. We can also employ hyperbaric oxygen therapy, where we supply 100% oxygen to the patient, and this can enhance healing of the Pyoderma Gangrenosum lesions. We can also do skin grafting, and this is usually done when the inflammation, the irritation within the wound has settled down. And this is usually done after some time when the patient has been on treatment for some time. And we also do treatment of the underlying cause. For example, if we have rheumatoid arthritis, ulcerative colitis, Crohn's disease, lymphomas, leukemias, we have to initiate treatment for these conditions because the Pyoderma Gangrenosum lesions cannot heal if the underlying condition has not been treated, and it will most likely recur if the conditions that is underlying is not treated. When it comes to the prevention of Pyoderma Gangrenosum, there are no best ways known to prevent it. However, If you have been diagnosed with Pyoderma Gangrenosum, please avoid further trauma to your body because this can escalate your lesions, and trauma can also cause formation of new lesions. Please also make sure that if you have any underlying conditions, for example, ulcerative colitis, leukemias, lymphomas, Crohn's disease, rheumatoid arthritis, these should also be under control because the lesions are going to worsen if the underlying condition has not been treated. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.